Hospitals were facing nursing shortages before the pandemic, and repeated surges of COVID-19 have made the situation even more dire. Take a look. Our nurses are not okay. A shocking 66% say the pandemic has made them consider leaving, while 1 in 6 healthcare workers already have nearly 500,000 workers gone since February 2020. They've witnessed hundreds of thousands of deaths, faced countless grieving and angry families, and the fallout continues to be felt coast to coast. At Mass General, 2 to 3 nurses face assault every day. And in California, 1 nurse was found dead of suspected suicide after his last shift. Inadequate nurse staffing and the resulting unhealthy work environments are primary drivers of stress, chronic nurse fatigue, increased substance misuse and abuse, anxiety and depression amongst nurses. And the nursing staffing crisis threatens the health and well-being of the entire healthcare system. Patients are already suffering.
I have been laying in my own soil for the last 2 hours in the emergency room.
While many permanent nurses leave to become travel nurses with higher salaries, but often slashed benefits, still others are just walking away altogether. One 16-year nursing veteran traded the recovery room for the road, becoming a truck driver. This industry exodus must be turned around. So how can we stop our nurses from burning out at the bedside? Joining us now is registered nurse Sarah Warren. Welcome to the show, Sarah.
Thanks, Sarah.
Thank you so much. I appreciate y'all having me on here today.
How long have you been a nurse?
Yeah, so I graduated from an associate's degree nursing program back in 2018. So I've had about 4 years of nursing experience, but the last 4 years have been incredibly difficult, and I could not have imagined what the most recent 2 years would have brought to me as a nurse. And it's strange looking back at my first 2 years of nursing and then what nursing has become. And it is truly heartbreaking. Many hospital systems decided in the beginning of the pandemic to, cut costs so that they could recover from having to stop elective surgeries right in the very beginning when lockdown started and cases started to rise. So the first thing that they started to do was take away 401k matching and take away certain benefits, including healthcare benefits, which not only impacted, the nurse themselves, but also their dependents. So they were cutting into things that, healthcare workers and nurses especially hold on to in order to stay at a hospital system job and stay in a role that's stay loyal to a system, if that makes sense. But our system started to show us that they didn't really respect us as employees and didn't really value us the way that they, kind of said they did through messaging on large billboards saying, "Thank you, heroes work here," plastering that around hospital systems, when in reality, those of us who were working on the front lines, taking care of these patients, were actually being treated in a way that just isn't respected, isn't what we actually deserved.
So, Sarah, this has got to be crazy making, right? Because on the one hand, we all watch hospitals, they're hailing you as a hero, but on the other hand, they're cutting your pay and not giving you everything you need simply to keep you safe. How was that?
Yeah, it was definitely something that started kind of a little bit of a fire in me, making me realize, that these institutions don't care about the well-being of their workers. How are they going to care about the well-being of patients? These patients aren't getting the care that they should receive. They're not getting the care that they deserve because the conditions just aren't where they should be.